Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give the valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. I hope this will be very convenient for the continuous study. My dear friends, in the last two classes we have seen how the dengue fever comes and what are the different phases of dengue fever, the febrile phase, critical phase and the recovery phase. Today we shall have classification which is beneficial for the purpose of treatment. Now dengue is classified into three types for the benefit of the treatment, convenience of the treatment, like mild, moderate and severe. What do you mean by mild dengue? It is with undifferentiated fever. Mild means the fever is there but it is undifferentiated. We don't know whether it is dengue or non-dengue. It is very difficult to differentiate with the other viral fevers. And it is having simple myalgia, arthralgia, etc. That means arthralgia, myalgia may be even there to some extent in other viral fever also. But in dengue it is extreme. So, but in this case, the case is mild fever. Therefore, mild is there, mild nature is there. Therefore, we are not able to differentiate whether it's a weak body pain because of dengue or some other viral infections. Okay. So most of the time these mild cases will run asymptomatic and there will not be any much complication and everything will be fine. Second is moderate. Now this is very dangerous and we have to take care of it. Moderate means, this moderate is of again two types. See, this classification is only for the purpose of management. Moderate is of again two types. Number one is simple dengue fever occurring in children with the comorbidities and dengue fever with warning signs. Now, what is the first one? Simple dengue fever occurring in children with a comorbidity. That means a child is there, child is immunocompromised, child is PEM, child is having some of the congenital heart disease, child is having some hemolytic disorders, okay, like thalassemia and all, or child is having some liver problems, okay, child is immunodeficiency. So, when dengue fever comes in such patients, then we will consider as moderate because it carries little high mortality rates. The mortality rate is little higher. Second is dengue fever with the warning signs. In the first one, simple dengue fever in a child with comorbidities. Comorbidities are there, risk factors are there, but child is not developing any warning signs related to dengue. But second is dengue fever, comorbidities may be there, may not be there. Dengue fever with the warning signs. Now in the moderate we will have these two important sets. Accordingly we have to go. Third one is severe dengue. Severe dengue means it is very severe either with the shock, hemorrhages and expanded, it's also called as expanded dengue syndrome. When the dengue is involved, the other systems of the body like nervous system, cardiovascular system, metabolic derangement, etc. And there is hypotension is there, severe organ involvement is there, loss of consciousness is there, and seizure development is there, cardiac failure is there. So they all comes under the category of severe dengue. Now, for the treatment purpose, for the identification, now we have to go through these three important steps. The first is mild fever. So, how you will do the assessment when the child comes to you? When the child comes to you, how will you go for the assessment? Now, suppose the child is coming to you, first identify the date of the fever, when fever started. Okay, suppose fever started 5 days back, fever started 2 days back, fever started 10 days back, whatever may be the case. Now, so when you get the onset of the fever, okay, duration and onset of the fever. Now, if the patient is coming to you on day 7, so you should understand that now he is in the phase of critical phase. If the patient is coming to you on the day 3, now you have to identify that, you should know that, you should infer that, yes, now patient is in the phase of febrile phase. In the febrile phase, you know the complications are less. In the critical phase, the complications are more, you know that. So therefore, date and onset of the fever is very important. This helps to decide in which phase the patient is coming to you, whether he is in the febrile phase, critical phase or in the recovery phase. Now, second question that you have to ask is, how is the oral intake? Now, if the oral intake is good, that means that GIT is good. Okay, GIT is not compressed. There is no intestinal edema. There is no GIT edema. There is no abdominal pain. Okay, so that also suggests that yes, it's okay, good. Then look at the warning signs. If there is no warning signs, well and good. If there is warning signs, then you have to be careful. Okay, look at whether the child is having any change in the mental status, or a seizure or a dizziness, etc. See, usually in the viral fever, the pattern is interfebrile period is always normal in children. Okay, so that is the nature of the virus, because it only produces chemicals. In bacteria, the interfebrile period is always sick because it produces toxins. Now, and therefore, look at the mental status. Okay, no, child is playful, child is only dull during the time of the fever, otherwise child is playful. Okay, no problem. Look at the urine output. If the bleeding has taken place, if the edema is taking place, capillary is leaking, then definitely the urine output also decreases. If the child is passing normally the urine 3 or 4 times or 5 times per day with adequate amount and all, then again this is also a good sign. Now, physical examination, you look at physical examination, look at the higher mental status, hydration status, tongue you see, lips you see, then hemodynamic status. Okay, because main thing is here hemorrhage, isn't it? So look at the pulse, look at the BP, look at the capillary refilling, very important. Okay, then look at the tachypnea, acidotic breathing, pleural effusion, etc., breathing difficulties, etc. Look at the abdomen, whether there is tenderness in the abdomen, hepatomegaly is there, ascites is there. So this is the step 1 patient comes to you. Okay, now, so this is understanding the stages and phases. These are the different symptoms that you will get. Now, patient may come to you in the stage of the stable phase, compensated shock phase, or hypotensive shock phase. Okay, now this table will go into helps to you to identify in which particular, whether the patient is stable, or whether the patient is the stage of shock, or whether the patient is in the hypotensive shock. Okay, so this table will go into help you. Now immediately you have to go for investigations. Patient is coming to the OPD, first step, you have to go for some of the investigations. What are all the investigations that will go? Number 1 is, first you go for simple CBC. Okay, CBC will give the amount of the RBC, hemoglobin, and then WBC, then platelets, everything. Okay, so it will give a rough idea what is actually happening inside the vessel. Now, WBC will be reduced, platelets will be reduced, PCB will be going to increase if really there is a problem. Then talking about this NSAG and IgM antibody. In the first phase, actually it is not necessary. See, IgM antibody, IgM is produced only in the acute phase. That means if the fever is there, if it is because of dengue fever, then the IgM, which is very specific to dengue virus, so that will go into rise. Okay, one is the antibody, another one is the antigen. So NS antigen you can find in the blood, and you can also find NS IgM antibody also. But in the first phase it is not necessary, costly also it is not necessary. Step 2, now go to the step 2. Here we have to diagnose and assessment the disease phase and severity. Now suppose if the disease is dengue, in which phase of the dengue fever it is there, whether it is having warning signs, whether the patient requires the admission or not. This has to be decided in this step 2. In the step 3, management you have to do. Okay, management. What is that? Group A can be managed. That means group A means is almost stable patients, mild patients. Okay, mild patients. So they can be managed by the OPD basis. No problem. Because there is no any warning signs, but you have to educate the parents very well or patient very well. That these are all the warning signs. If any of these warning signs start, immediately you have to report. Okay, and suppose the child is able to tolerate the adequate fluids, oral feeds, then it's a very good sign. Okay, always it's a very good sign. If he is passing urine normally at least every 6 hours, that's also a good sign. It can be managed by OPD level itself. So all these patients can be managed on the OPD base, but ask him to come to the regular checkup and explain the warning signs promptly. Now, management of the group A. That means these patients, mild patients, how we are going to manage them? OPD basis you have seen, you have taught everything to him, you have explained about the warning signs. Now, advice that you have to give is plenty of the fluids. Go for the fluids, and bed rest. And when you give the fluids, actually don't go for the plain water. Okay, always advise him to take some water which is fortified or supplemented with the fortified with the electrolytes. At least the nimbu pani, what we say, or shikanji, sharbat. So instead of taking plain water, he has to take that because there is a lot of electrolytes. So plain water may cause hyponatremia in the blood. Plain water may lead to hyponatremia in the blood, so which is not good in case of dengue. Therefore, always plenty of fluids should be taken, bed rest. But when you take the fluids, ORS or coconut water is very good about the plain water. Now, if there is a fever, yes, if there is a fever, always go for to decrease the discomfort caused by the fever, go for paracetamol. And not to suppress the fever, to decrease the discomfort caused by the fever, go for paracetamol 500 to 600 milligrams for high fever. Now tepid sponging. Now tepid sponging is important. Next is tepid sponging. Tepid sponging should be always done by the tap water, not by the ice water. If you are doing tepid sponging by the ice water, it causes a vasoconstriction of the vessel and heat distribution or heat evaporation will not be proper. Okay, instead of that you have to go for tepid sponging by using simple tap water. And don't advise any painkiller. For example, any non-steroidal anti-inflammatory drugs, aspirin, dispirin, etc. So don't go for any of the painkiller because what actually happens is this can increase the bleeding tendency because all these drugs will go into block the prostaglandins. Okay, so therefore this may increase the bleeding tendency, especially in the abdomen and all, gastrium and all. Therefore, don't go for any of the anti-inflammatory drugs. Now come to the group B. Group B is moderate. Okay, that means in the group B, one is with the comorbidities, another one is with the warning signs. So in this group, what you have to see is, suppose the patient, suppose elder patient is pregnant or old aged one, immunocompromised, with diabetes mellitus, with renal failure. See, these are all the high risk period. In these patients, dengue fever may be very dangerous. Okay, so that means suppose they are living in a remote areas, living alone in the far area, etc. and there is no transport system, etc. So in such a patient, always it's better to advise them for the hospitalization and keep them in the hospital and observe them for 1 or 2 days, because they are living in a far area. Immediately they may not come and get a report to the hospital and admit. So to avoid all these things, try to hospitalize them and observe them for next 2 or 3 days. And then again see whether the warning signs are there or not. Now in detail I can explain the management of the group B in the hospital, how you have to manage him, and that portion we will skip. Now suppose you have to manage them if the warning signs are present. Now suppose if the warning signs are present, you have to manage them. Okay, so while managing also we shall go for the baseline hematocrit values. First you do the hematocrit value, then you start the maintenance fluid. Okay, maintenance fluid. So usually we will start with the isotonic saline, 7 ml per kg per hour, 7 ml per kg per hour, 5 ml per kg hour, and 3 ml per kg per hour in the first 2, 4 and last 1 hour. This is the, usually we will follow this. Then again check the hematocrit values after this much of fluid therapy. Then if it is same and or slightly elevated, then we will continue with 3 ml per hour for next 4 hours. If the hematocrit is raising, then it suggests that bleeding is taking place. Then we have to go for the next treatment, and we have to go for either crystalloids or either we have to go for the colloids. Okay, either we have to go for the crystalloids or colloids. Now which fluid we have to give? This is a big question, because excess fluid in dengue fever is not useful, because it may worsen the condition, because it increases the edema. Whatever fluid you are giving, that is leaking out. That means the fluid you are giving here, and that same fluid is going into the extravascular space after the leakage. So in the extracellular space, it is increasing the edema and causing further complications. So which fluid has to be given? The most preferred is crystalloids. That means this isotonic salines and then ringer lactate and all those things. but it has got its limitation, because whatever fluid you give, only one third will going to remain in the intravascular space and two third is going to the extravascular space or extracellular space, because the leakage is on. Leakage is not blocked at. So it may cause further edema increase, and not only that, it can also cause a hyperchloromic metabolic acidosis. Hyperchloromic metabolic acidosis. Talking about the colloids, almost 100% they remain in the IV space. If you give the colloids, they will remain in the IV space. But in the dengue, we need to remember that it is not 100%, because even the colloid also leaks out. So 100% will not stay in the IV space. So there will be also decreased albumin in the blood. So colloid in the intestinal is more dangerous than the crystalloids in the intestinal, because it can draw the fluid from the intravascular space also. Okay, so among the fluid, the crystalloid is always the first choice, and that should be also given under limitation by looking at the patient's condition. One thing which is there, maybe in our find fluid is leaking, therefore we will give more fluid. No, because if you give the fluid also, that also going to leak and further increase the edema. So fluid should be given carefully. Now these are some of the explanations are there about the choice of the fluid. Colloids, what are the colloids which is available. Okay, if you give the ringer lactate, what happens, like that. And this is the normal maintenance fluid when you want to give. Now management of the group C. Group C means a very severe conditions. Hemorrhage happened, hemorrhagic shock is there. All the warning signs will be there. Multi-organ dysfunction is there, and bleeding is continuous, like that. So definitely this patient has to be admitted in the emergency. And there are two types of the shock, as I explained in the table already: compensated shock and hypotensive shock. In the compensative shock, crystalloids are given 10 ml per kg per hour over the period of 1 hour. And if there is an improvement, then reduce the fluid like 7 ml, 5 ml and 3 hour for 2, 4 and 1 hour. And if there is no improvement, then check the hematocrit value again. If it is increasing, it means that plasma loss is taking place. So go for the colloids 10 to 20 ml per kg hour for 1 hour. And if there is improvement, then colloids will be reduced further. In case of improvement, 7 to 10 ml per kg for the next 2 hours, followed by the fluid reduction, just like followed by the crystalloids. First colloids, after the colloids, go for the crystalloids like 7 ml, 5 ml and 3 ml in the first 2 hours, 4 hours and 1 hour. This is one condition. If the hematocrit is decreasing, hematocrit is increasing, one condition. But suppose hematocrit is decreasing, that suggests that the bleeding is taking place along with the RBCs also. Okay, so we now that means here we have to go for the blood transfusion. That means hematocrit is increasing. Hematocrit is increasing and bleeding is taking place. Okay, and RBC and all coming down. RBC count is coming down. Now that suggests that blood is, that means RBC is going out. So here simply by giving the crystalloids there is no use. Here you have to go for the blood transfusion. Okay, 5 to 10 ml per kg packed RBCs. Packed RBCs or the whole blood 10 to 20 ml should be given. So role of the platelet transfusion is not so good. Role of the platelet transfusion is not so good. It can be given prophylactically if the platelet count is less than 1 lakh, less than 10,000. Okay, because I told that the antibodies are also there against the platelets. So whatever the platelet you give, so that will be destroyed by these antibodies. Therefore, this may not be much beneficial, but prophylactically you can use it. Suppose if there is a hypotensive shock is there, 20 ml per kg crystalloids or colloids over the 15 minutes it should be given. And if there is improvement, then try to reduce the dose as explained earlier. And if there is no improvement, check the hematocrit, and if it is decreasing, go for the blood transfusion. If the hematocrit is increasing, go for the colloids and reduce as explained earlier. Now whenever the patient is there in the hospital, we have to go for the checklist. Following should be monitored minimum for every 3 to 4 hourly: body temperature, respiratory rate, heart rate, BP, pulse pressure, capillary refilling time, temperature on extremities, abdominal pain, vomiting and bleeding episodes. This has to be checked. There are some of the treatments are totally not beneficial, that can be better avoided. For example, there is no benefit of any steroids in this case, or any transfusion of the factor 8 hemophilic factor, or von Willebrand factor. There is no use. IVIG, no use to combat the antibodies, no. Interleukins also no use. So tranexamic acid, that is also of no use. So aloe vera, goat's milk, papaya leaf, although papaya leaf is oftenly used, there is no any estimated use of it. Now, discharge criteria, how we will going to discharge the patient. Clinically, if the fever is not there for 48 hours and improvement is there in the clinical status and general well-being of the child is there, so then you can discharge the patient after 48 hours. Okay. Return of the appetite is very important, because return of the appetite suggests that fluid from the peritoneum is now shifted back to the vascular space and there is no compression and digestion and metabolism takes place normally. Look at whether the patient is hemodynamically stable, BP, pulse and all, then you can discharge. Adequate urine output is there, you can discharge. No respiratory distress, yes, you can discharge. Lab criteria, important is increasing trend of the platelet. Platelet which was previously coming down, now it start go on increasing. So that's a very, very good sign, because it suggests that fluid is now coming back to the vascular space and leakage has been stopped. So this is in general the management and understanding of dengue fever. Thank you very much.